Dr. David Kruse, and I'm a primary care sports medicine physician. My practice is mostly sports medicine injuries, musculoskeletal care, care of multiple types of athletes. I did my undergraduate training at Berkeley and was a scholarship athlete there as a gymnast. After that, I was with the national team for gymnastics for about 3 years before going to medical school. That's my personal sports background. So back pain in athletes can be very common, and there can be many different reasons for back pain in an athlete. Certainly with sports, there's a lot of strain and stress on the body, and that can include the back, and it can be something as simple as muscular strain or a muscle type of overuse, fatigue, or pain. With any injury, though, including the back, we're always going to want to differentiate between something that is more muscular overuse or something that is structural. We're going to be more concerned about a structural injury when it comes to the back, especially for their return to play and long-term health of the back. Some common causes of back pain in sports, and at times we'll talk about gymnastics because gymnastics, it's very common to have back pain, but there can be similar forces across sports. A lot of it is in their training volume. A lot of sports, including gymnastics, there's very limited downtime and rest, between the off-season training, transition into the competitive season, and really no rest during that competitive season. So it could be over training, not cycling appropriately in terms of those rest periods, or doing appropriate cross training. Most athletes have some sort of muscular deficiency that can lead to back pain. In gymnastics or other athletes, we think of them as being very strong, especially in gymnastics when it comes to the core. But even in gymnasts, we can see a lot of strength deficiencies. It could be a flexibility pattern. Again, gymnasts can be very flexible in certain ways, but it can also be very inflexible in other ways that can put a lot of stress on the spine. Sometimes it can be a opposite reason. They can have too much mobility, and if we don't balance a lot of motion in the spine with strength, then that can cause problems too. In gymnastics, there's a lot of repetitive extension and rotation, again, that we can see in other sports as well, that can put a lot of stress on the spine. So it's always important to differentiate a standard amount of pain in sports with the back versus something we need to be concerned about. So it's important to know how to differentiate that and things to watch out for as parents or coaches or individuals involved in sports to identify when there's pain that we need to worry about or seek further evaluation or care. And for me, it's a lot of looking at trends. So if an athlete starts to develop pain in the back and that pain starts to become a little bit more consistent, the pain becomes more isolated to one particular area as opposed to just some generalized pain. If it's starting to limit their participation, so there can be some soreness that they get with one particular hard workout and goes away by the next day. But if the pain continues on for a couple days, it's starting to impact their ability to train in subsequent workouts. Pain is getting worse, again, more localized. And some of your general things to deal with muscle soreness isn't getting them better, such as, again, rest or icing it, or maybe taking a day or two of some Motrin. If all of those things are not helping and that pain is continuing and creating any trends like I just mentioned, then those are usually red flags or signs that might prompt you to get a further evaluation.